In today's video, we're going to be talking all about PCOS. What is it? What are some common symptoms? And how do we diagnose it? I'm Taylor, a physician assistant working in OBGYN, and my goal is to educate you on everything related to women's healthcare. So let's break it down. PCOS is such a common disorder, but it is so commonly misunderstood. PCOS stands for polycystic ovarian syndrome, and I absolutely hate the name because it is so confusing, and this is where a lot of the misunderstanding comes from. A lot of people think that if they were diagnosed with a cyst on their ovary at some point in their life, or if they've had 2 or even 3, then that means they have PCOS because they've had multiple cysts. And that's just not correct. There is a massive difference between PCOS, which again is a hormonal imbalance that we're gonna completely break down and dissect today, versus an ovarian cyst seen on an ultrasound. So inside your ovary, we have a lot of what we call follicles, and inside each follicle lies an egg. And during healthy, normal cycles and normal ovulation, one follicle is going to mature enough where it's going to pop out an egg and ovulate or release that egg each month. In PCOS, because there's a hormonal imbalance, we're not ovulating correctly. So those follicles are not getting mature enough to pop out or release an egg. So on an ultrasound, you're going to see multiple immature follicles. And when you look at this on an ultrasound, it looks like a fluid-filled sac. And by definition, that's what we call a cyst. So that's where they get the name of polycystic ovarian syndrome. But on the flip side, if you look at an ultrasound and you see someone who has a simple cyst or a dermoid cyst or a complex cyst, that is also a fluid-filled structure, but it's like an outpouching on the ovary itself or within the ovary. It's very different than a follicle, which is normal. So if we take a look at this photo here, it's going to represent 2 ovaries. One ovary here is going to represent PCOS, where you see all of these multiple little follicles inside the ovary that are immature and they're not ready to ovulate yet. Versus this picture here, you'll see a few follicles which are normal, and then you'll see an outpouching, which is a fluid-filled cyst seen on an ultrasound. This, by definition, is what we would consider something like a simple cyst. They're problematic, they can cause some discomfort and some pain, but they are very different than PCOS. Now, in order to understand what's happening in PCOS, what the hormonal imbalances are causing, and why we're getting these symptoms, we need to first understand what happens in a normal menstrual cycle. So in a normal menstrual cycle, you have your brain, which is going to release certain hormones which are going to circulate to your ovaries and your uterus. They're going to tell your uterus to stimulate those follicles, to make them mature, make them grow. Another hormone is then going to be released from the brain, creating that ovulation or that release of that mature egg. That egg is then going to produce certain hormones that are going to circulate back to the brain to tell that cycle to shut off. So I have that demonstrated here on a nice diagram for you to understand, so that when we break down PCOS, we can understand exactly what's going on. So here's your brain, here's your uterus, and here's your ovaries. Your brain is going to release a hormone called FSH, or follicle stimulating hormone. That circulates to your ovaries, and it tells those follicles to stimulate, to mature, to grow. Once we have one that grows to a certain point, your brain then releases a hormone called LH, which is what stimulates that ovary to ovulate and release that egg. Once we have that egg released, that egg is then going to release progesterone, which is going to go to the uterus, telling your uterus to maintain the thickened lining and prepare for implantation and to prepare for pregnancy. It's also going to release a hormone called estrogen, which is going to circulate all the way back up to the brain, telling the brain to shut off this cycle because we have now released an egg. We no longer need any FSH or LH. And then when pregnancy doesn't happen, the egg or the corpus luteum dies away, progesterone and estrogen levels decrease, which is going to stimulate the brain to now release more FSH to start that cycle again. Now, what happens in patients who have PCOS is you have more than the normal amount of follicles, and those follicles each month don't mature correctly. So if we go back to this diagram here, this is going to show us exactly what's happening in patients who have PCOS. So you have your brain, and your brain is going to release FSH. FSH is going to travel to the ovary, but you can see this ovary is got a lot more follicles than what's normal. So because of that, the FSH gets a little bit diluted or a little bit lost. So it's not strong enough to be stimulating these ovaries to mature, mature, mature. Because of that, there's a dysregulation in the cycle. Now, the goal of your ovaries is really to produce estrogen. Like I said, once we release the egg, progesterone and estrogen gets produced. Estrogen is what goes back to that cycle and shuts it off. Because we're not ovulating, we are not producing progesterone. So that is not going to tell the uterus to prepare for pregnancy. However, we are going to produce a very small amount of estrogen. That small amount of estrogen is enough to circulate to the brain to tell it to shut off the FSH. Now another hormone is going to be dysregulated. So remember when I said we have LH coming from the brain to the ovaries that's stimulating that egg to be released? Well, in patients who have PCOS, the LH goes to the ovary, but because the ovary is not releasing an egg and it's not producing progesterone, that ovary gets confused, and that LH is now telling the ovary to produce testosterone. So testosterone is considered an androgenic hormone or a male hormone that causes a lot of symptoms in patients who have PCOS. So as you can see, there's a dysregulation in the normal hormonal axis that the brain and the ovaries get confused. Your body does not have enough FSH to stimulate a mature follicle. That follicle then cannot mature and release an egg. The egg does not produce progesterone. It produces a small amount of estrogen that goes and it shuts off the FSH, which leaves you in this consistent loop of no mature follicles and no ovulation. Because there's no ovulation within your egg, the egg gets confused, and instead of producing a lot of estrogen, it switches and produces testosterone. So that is exactly what happens hormonally in patients who have PCOS. Now, like I said, testosterone is considered an androgenic hormone. What does testosterone do to the female body? When you have excess levels of androgens like testosterone and another one called DHA, we can have symptoms like acne, facial hair growth, thinning of the hair on our head, an increase in abdominal fat, an increase in weight, mood changes. It can lead to diabetes, insulin resistance, high blood pressure, high cholesterol, metabolic disorder. This high circulating level of testosterone in the body in patients with PCOS is what leads to all of these typical PCOS symptoms. So now that we understand what it is, let's break down exactly how we diagnose it. So the diagnosis criteria is called the Rotterdam criteria. The Rotterdam criteria is a set of 3 different things, and in order for you to reach the diagnosis of PCOS, you only need to have 2 of the 3. So criteria number 1, and the hallmark symptom of PCOS, is irregular periods. Symptom number 2 is going to be either symptoms associated with high androgenic levels that I just discussed, like testosterone and DHA, or blood levels that are going to show that your testosterone levels are higher than normal. And criteria number 3 is going to be evidence of PCOS on an ultrasound. And what that looks like is multiple swollen, immature follicles, typically following the periphery of the ovary, or what we would call a string of pearls. So again, we're having multiple of these follicles, more than the normal person would have, and they're going to be immature and they're going to be beefy and swollen, but they're not going to be enough to mature to have that release of an egg. And again, for you to get the diagnosis, you only need 2 out of those 3. So patients who are coming into the office, if they're having irregular periods, symptoms like acne and facial hair growth, right there can be enough to give you the diagnosis of PCOS. Your provider may do blood work in order to check your hormone levels. Typically, patients who have PCOS have, again, high levels of testosterone. Their progesterone may be lower than normal, and the FSH to LH ratio may be off. And then number 3 would be doing an ultrasound to, again, assess what your ovaries look like. So now that you understand what PCOS is, what's happening inside your body with the hormonal imbalances, and what symptoms it causes, I want you to ask any questions that you have regarding PCOS in the comments, and I'll address that with treatment options and lifestyle modifications in our next video.